So how did this treatment philosophy come about?
This was honestly an accident, this finding. So there's a group of the medical field, physical therapists that are certified in McKenzie physical therapy. Robin McKenzie was this physical therapist in the 80s who basically pioneered treating disc issues, so treating spine problems. And from treating these spine problems, he realized that a lot of other conditions that were getting labeled as local problems, like a hip pain, a knee pain, a foot and ankle pain, shoulder, elbow, wrist, a lot of these conditions weren't actually coming from those areas. They were coming from the spine, and the area that correlates in the spine to these regions, so the area of your neck that correlates to your shoulder, was actually the problem, and you were getting symptoms in your shoulder. You were going to doctors or physical therapists or chiropractors, and they were looking where you had symptoms. They were looking at your shoulder. And the treatment wasn't really working. The treatment, or maybe it would work a little bit, but it wouldn't work completely, it wouldn't work quickly. And we realized that we're treating the wrong area, and it was a spine problem all along. So these therapists treat more like this than anything. And I became certified in this as well, among other orthopedic certifications. And it was kind of by accident and over time that we realized that if a spine issue can be the cause of your knee pain and get misdiagnosed, why can't it be the cause of your abdominal pain and be getting misdiagnosed? And a few years ago, I had a friend that had some difficulty breathing. And he went through all the normal processes. You know, he went to the hospital, he went to the ER, he went to his primary care physician, he went to the pulmonologist, and nobody was finding anything, but they kept labeling him with asthma, exercise-induced asthma, even though when he exercised, he actually felt better. They were referring him to a cardiologist, and then finally I said, you know, let me take a look, maybe there's something on your spine that could be causing this. And we found it, and as soon as we worked on it, he immediately sat up and breathed better. Then, you know, that could have just been a one-off, but then it happened again with another patient with the same similar presentation. And this patient was actually living in California, so a different state, and we were able to treat her via telehealth.